Hi guys, welcome back. We're gonna continue about a video about how do you continue the maintenance fluid. So any fluid that you give to the patient, it has to have three components, right? You have to correct the deficit, then you have to correct the ongoing loss, and then you have to correct the maintenance dose. Alright, so these are the three components. So in the previous video we did how do you calculate the maintenance dose, and now we are going to see how do you correct a deficit, and you are going to calculate the ongoing loss, right? So this is the total fluid you require by a patient, right? So how do you know a person how to correct the deficit in the first place, right? So for that you have to know what is some dehydration and severe dehydration, right? This gap you have to understand. Now if your body weight 5 to 10% of your body weight is lost, it is some dehydration. In severe dehydration, more than 10% of your body weight, is that right? Then you have the patient is very irritated, it's crying, irritated, tensed. But in severe dehydration, the patient is so weak that the patient is kind of lethargic or like sleeping, right? Here the patient will be eager, he will be wanting to drink more and more water. But in severe dehydration, the patient may drink water, but in these certain cases, the patient is so weak that he or she is unable to drink water or drink very poorly, right? Is that right? Now the next thing we are able to see is that we want to see the skin pinch. Where are we going to do it? We are going to do it in the abdominal area, right? Just near the umbilicus. So in general, just to give you an idea, imagine this is my umbilicus. You're not supposed to do in your wrist, okay? You're not supposed to do it on this part. You're supposed to do it in the abdominal area. So if I pull this skin like this and I leave it, right, it goes immediately. That means I'm not able to see the skin is pinching down, right? If I'm able to see the skin is going down, I'm able to see with my naked eyes that the skin is going back to its normal position, then I'll say it as some dehydration, okay? And if the patient is having severe dehydration, the skin will be somewhat like this only, it won't go down, or it will go very very slowly, or you can see the skin is like in a tented position, just like the tenting. So whenever you go for a this thing, any camping or something, whenever you make the tent, it is in that shape. Is that right? The next thing is that if you see, for the pulse will be increased, but in severe dehydration the pulse will be, the patient will be having tachycardia, okay? Another thing that you have to see is capillary refill time. In some dehydration it will be 3 to 4 seconds, normal is less than 2 to 3 seconds. To be very frank, it is quite very very fast. Just to see my skin pinch, capillary refill time, here I press it, it became blanched and it filled, pressed and filled, press, gone, press, gone, press, refill, press, refill. Yeah, so it's very fast. If it is 3 to 4 seconds, we will say it is some dehydration. More than 4 seconds, definitely severe dehydration, right? Here the blood pressure will be normal, but in some severe dehydration the blood pressure may be normal or may be decreased. Is that right? Another thing that you have to see is decreased urine output, very dark urine. In severe dehydration, there will be very 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 much decreased urine, or in certain cases you might not be able to record the urine output, it will be just in some drops, right? So this is how you differentiate severe dehydration and some dehydration. Obviously you are having no dehydration, so we are not worried about no dehydration. There are only three categories to say a person is having status of a person who's having hydration status: no dehydration, some dehydration, severe dehydration. Again, I want to repeat this. Nothing like moderate dehydrations or little dehydration. No, the word is some or severe or no. That is the wording. Is that right? All right. So how are you supposed to calculate the deficit? That means how you're going to calculate the deficit. Remember, for every percent body weight loss, right? For again, as I told you here, some dehydration means 5 to 10% body weight loss, right? For each percentage of weight loss, you are going to give 10 ml into the percentage, right? And then you're multiplying per kg body weight. Okay, just to give you an idea, in some dehydration, let's say there is 5% loss. Okay, so you're going to multiply 10 times 5. This 10 is constant. Okay, so it will give you 50 ml per kg body weight, right? Or if you want to take it to the upper limit, 10 times 10 is 100 ml per kg body weight. Generally we take is 7.5, but some dehydration can be 10 to 5 to 10%, right? So if you want to do it again here, so you are supposed to multiply 7.5, right? So this amount of fluid that you're giving, right? This one is going to correct the deficit. The person is having deficiency of fluids. This is going to correct it, right? Along with this, you have to also include the maintenance fluid. Along with this, again, my friend, you have to see ongoing loss. Now, what are these ongoing loss? Vomiting, fever, you are having excessive sweating, you are having loose motion. So in this, you are losing fluids, right? Sorry. So how do you do it? Ongoing loss formula. If the patient's age is less than 24 months, that means a small baby, right? Or the patient age is 2 to 10 years or more than 10 years. Okay, for this you are going to give 50 to 100 ml ORS. That you get it in the market, right? You get ORS. You are going to give 50 to 100 ml of ORS for every episode of loose motion or vomiting. Every, okay? Same thing here, it will be 100 to 200 ml. And if the patient is more than 10 years, you can give as much the patient wants to drink. If the patient is thirsty, give as much as you want, right? As much as the patient wants to drink. That is the thing. So again, I just want to summarize. This is what you are going to do for the ongoing loss, this formula. Is that right? For deficit, you have to correct the deficit by this formula. Remember, this 10, whenever you multiply with 10, is constant. That means every amount of percentage, that is every digit of percentage that is lost, right? You are supposed to multiply with 10. I'll write it down in scripture. 10 ml for each percentage of weight loss. So you're supposed to multiply 10 ml into each percentage of weight loss. If it is 5%, then you're going to multiply 10 into 5. If it is 15%, you're going to multiply by 15 into 10, right? This 10 is constant, right? So this one is to correct the deficit, this one is to correct the ongoing loss, and the previous video we studied is this thing, how to calculate the maintenance dose. So this was about the fluid management. In the next video, I'll show you what is the rate, how fast you're supposed to give the fluids to the patient. All right, thanks.